Welcome to the first episode of the Amref podcast, placing people at the center of Africa's health systems. And I'm your host, Halima Sabwa. In today's episode, we'll discuss the intersection of people-centered health systems and primary healthcare, exploring how these concepts align to empower communities across Africa. Joining me today is our special guest, Anne Gitimu, Program Director of Family and Reproductive Health at Amref Health Africa in Kenya. Welcome, Anne, to the show.
Thank you, Halima. As you've heard, my name is Anne Gitimu, and I work as the Program Director for Family and Reproductive Health at Amref Health Africa in Kenya. I lead our work in working with government, with our stakeholders, with communities, to ensure that mothers have a joyous pregnancy, they have a safe delivery, and thereafter they recover well, and that their newborns survive and thrive. And also we work a lot with young girls and boys to ensure that they fulfill their dreams in education and thereafter joining the workforce. So it's really a pleasure to be here today in this podcast. Thank you.
You're very welcome. That's excellent. And we all know right now that the government is big on primary healthcare and primary healthcare initiatives. So can you explain what the intersection between primary healthcare and people-centered health systems is? Additionally, how people-centered health systems can give Kenyans better access to healthcare services?
Thank you, Halima. Primary healthcare is an approach that governments use to organize the health systems. It's not a new concept, but there has been a recent recommitment to support primary healthcare. And majorly, it looks at three key areas. The first being the whole issue of ensuring that services are integrated and that they are holistic. Secondly, is that is about the social determinants of health, ensuring that important issues such as education, infrastructure, climate, livelihoods, amongst others, are addressed in order to improve health, and also that policies looked at, they are multi-sectoral and their actions as well. Then thirdly is about empowering individuals and communities to take action. So in summary, that is about primary healthcare, and it's quite an important approach that the government has picked on to ensure that Kenyans achieve the highest attainable health.
Okay.
Thank you.
And what do you believe the intersection between primary healthcare and people-centered healthcare systems is?
Yeah, thanks for that question. First and foremost, when you look at people-centered health systems, it's putting people at the center of health systems, ensuring that you understand their needs, you understand their preferences, their aspirations, and their values in the context of health systems. So primary healthcare is very important in regards to pushing this whole agenda on people-centered health systems. The first issue is about equitable access. Primary healthcare is about ensuring that people have access to health services, including people who are in last mile, people who live in informal settlements, rural communities, as well as like refugee populations, amongst others. So ensuring that they are accessed with services, which is a PHC strategy, it addresses that whole need of putting people at the center. Also, providing quality services is very crucial for people-centered health systems. So in that regard, it also contributes to ensuring that healthcare workers have the right skills in terms of not just provision of services, but also understanding these needs, the aspirations, the preferences, how they communicate to clients, getting feedback, and that kind of thing. So the two are quite interlinked and are mutually reinforcing.
Okay. And in Amref's 2023-2030 strategy, how does our organization promote integrating people-centered healthcare systems and PHC to improve access and equity?
In our strategy, which is primarily really about transforming the health of communities through primary healthcare, And one of our key pillars is actually people-centered health systems, and the other is about addressing the social determinants of health. When you look at our strategy, the first thing that we are looking at is about convenient delivery of services. It's about equitable access. How do we reach communities that are nomadic, have a nomadic lifestyle with services, ensuring that we are scaling up models that we have tested in the past to ensure we reach this kind of communities, working with women, with men, children who live in informal settlements, with models, scaling models that are able to reach highly mobile populations in urban cities. So that is the first thing that we are looking at when we look at people-centered health systems. Then secondly, our strategy looks at quality. And when you look at quality, while it has many dimensions, we are looking at do we have the right skills for health workers? Do we have the right numbers? Is the equipment, commodities in facilities, and all the building blocks of the health system, just to ensure that women and others, and children and men, are reached with quality services. So in that regard, it's about looking at the needs of the communities. Then thirdly, our strategy is also looking at things to do with governance and accountability, ensuring that institutions are strong to respond to the needs of communities, and also that they're held accountable in terms of the policies that we have come up with as a country, and also various commitments, and also ensuring that that communities are resilient to various shocks such as drought, floods, and the like. Yeah, okay. Thank you.
And we've talked about local communities and their needs. So how can these communities actively participate in designing and implementing healthcare systems?
Yeah, thank you. There are various ways. The first is something is an approach that we have employed over time as Amref through the human-centered design, just ensuring that we are co-creating and co-developing programs with local communities, and that their needs, their preferences are taken into account. So this is an approach that we use in all of our programs to ensure that the community voices, the women voices, the voices of the girls, of the men, are part of that program. So the first approach is the human-centered design. Then secondly is about identifying champions from communities. For example, we work a lot on GBV under the program that I work in, and majorly in the work of female genital mutilation or cutting. So creating a pool of champions of either girls or women who have undergone the practice or not, but ensuring that they have the capacity to make a case for themselves in regards to policy, in regards to legislation, and even taking action at the community level to ensure that girls are protected from these harmful practices. So that is another way of involving local communities. Thirdly, is about working with the very local community-based organizations, building their capacity. We have a model that we have dubbed as Organization Development System Strengthening, ensuring that they have the capacity to implement programs for themselves, to hold stakeholders like Amref accountable, governments accountable. So just ensuring that local communities, also through their CBUs, have the requisite skills to be able to engage. Thank you.
Excellent. And as we wrap up the discussion, we've already talked about some of the strategies that Amref employs, but what strategies does RMNCA specifically employ to foster more effective engagement with government and other stakeholders? And this would ensure that, Kenyans remain at the heart of Kenya's healthcare systems. So are there any strategies in place as RMNCA that you could share with us today?
Largely, we drove from the organizational strategy, and that is what we implement at the program level. But of course, we deal with perhaps very different needs. But what we do is, let me give again the example of human-centered design. So while we understand that a woman who is pregnant has very particular needs in terms of their reproductive health needs, we want to, through the primary healthcare approach, we want to look at this woman as a woman who could also be exposed to non-communicable diseases. So ensuring that there is preventive actions, or there is also screening and referral for treatment. So looking at this woman, not just as a pregnant woman, but as somebody who needs services beyond reproductive health services. So that is one of the things that we explore using the human-centered design. And another thing that we do that is very specific to reproductive health, reproductive and maternal health, is because we offer a lot of services at the, we give technical assistance to government to offer services at the lowest level, dispensary at community level, is ensuring that there is a feedback mechanism from the communities, from the women. Are they happy with the services? What would they want to see improved in the health facility? What would they want to see improved in the community health services? So ensuring that there is that a feedback mechanism is very crucial for us to improve our services. Then the other important thing that we do, which is also organizational, is about performance improvement, ensuring that we are using data, that we have very strong measurement, we are using data to make decisions, that data is collected at every level, and that it is visible for policymakers, for technocrats, at the community level, for community health promoters, for them to be able to improve, to take action, corrective action, and also to scale things that are working. So those are some of the things that I would mention that we deploy as a program.
Okay. Thank you so much for that. And to our listeners, thank you so much for joining us on our first ever podcast on primary healthcare and placing people at the center of healthcare in Kenya. I am your host, Halima, and if you have any concerns, questions, or queries, our YouTube link is here, our Instagram link is here, and our Twitter link is here. And thank you so much. Goodbye for now.